Welcome to today's Q&A. And today with us, we have Nevzat from IVF Cyprus Hospital. Welcome.
Hello, everyone. Hello, Andre. How are you?
I'm okay, thank you. And today we're talking about sperm donation. And it's such an important topic because men are 50% of the equation. And they say that sperm has been declining in quality over the years. So there's more and more men needing sperm donation as a route to experiencing parenthood. So we'd like to talk a bit about that. And maybe we can start by the recommended situations in which men need to consider sperm donation.
Yeah, thank you for the question, Andrea. So basically, when we perform the semen or the tissue test of the man's sperm, if we don't find the motility or the quality of the sperm, it's very low quality, and there is no movement, we of course apply for other small operations like TESA or TESA to get the sperm directly with an operation from the man. But with that, even that we cannot find any live sperm, then we definitely recommend the sperm donation. The second one is about if the man is actually having any genetic disorder, to avoid for the next generation, for the baby to basically have that genetic disorder. We also recommend to use sperm donation treatment to avoid, any kind of a genetic disorder. That's, I would say, the two main reasons. And maybe the third one I would recommend, if there is any situation that any disease that sexually might be transmitted with the sperm, not only with the action, but also with the sperm. We also, it's like a bit of the genetic disorder side, but any illness, we really recommend to use for the sperm donation.
And what are the regulations like in North Cyprus? Is there a lot of sperm donors available?
Yeah, yes, there's a lot of, it's regulated by the Ministry of Health. There's a, for example, age limit for the donor. So for the sperm donation, the donor needs to be between age 20 and 45. If it's below and above, you cannot consider it as a donor. But as a Cyprus IVF hospital, we don't use any local donor. We work with two big sperm banks in the world. One is Seattle Sperm Bank, and the other one is Kyrios Sperm Bank. They're mainly, their head office is in Denmark, but right now they also have an office in South Cyprus. So we are collaborating with them. We can really have access to a huge sperm donor bank via them, and there is a huge variety, and we know that it's 100% gone through all the tests that we required, and they have a big ethnicity groups, different diversions, and very good quality, and it's approved by with the bank. So therefore we prefer to use the sperm banks, not the local sperm donors on the sperm donation part.
And when people choose a sperm donor, do they choose certain characteristics, or do they look at the quality of the sample? How do they choose the donors?
Yeah, not for the quality of the sperm, because there is certain criteria for that, and the quality of the sperms approximately, they're all same on the sperm banks that they're providing this service. But of course, the characteristic, we receive the profile from the couple, so we know how is the man look like, what's the height, weight, hair color, eye color, all these normal characteristic, and the ethnicity, and then we go through the sperm bank system, and basically we enter this characteristic, and then the bank provides us the best match options, and based on that options we can choose. Unlike the egg donation, here there is some VIP donors which we can also see their childhood pictures. We have to pay extra for that, but if the parents really want to see the guys, how is the child should look like picture. There's some such options that we can see their childhood pictures.
Okay.
Yeah.
So that means that we can, for a couple, they can choose sperm from someone who looks like the male partner.
Yes, exactly. That's the main goal.
If it's a single woman, can she choose any characteristics?
Yes. We have, that's the other part, the IVF treatment and all the donation program, it's allowed and legal in North Cyprus for a single man or single woman. For a single woman, she said, for example, we had a patient from Africa, and she said, I definitely want blonde hair, blue eyes, sperm donor, and ethnicity, if we can find from Denmark. Easy. We put the profile based on what she needs. We find the best match for her, and then we actually offer her this sperm donation program, and now she's 7 months pregnant. So we are really looking forward to see because it's going to be a mixed race. She's from Guinea. Yeah, it's going to be a mixed race and a nice, good-looking baby, healthy. So we have this kind of cases, of course. We have lesbian couples. Yes. They also, we said, okay, how can we choose? I mean, do we need to put, I said, look, whatever you want, that's the best part with the sperm donation for lesbian couples. Please go ahead and choose whatever you guys desire, because it's legal. We can choose whatever we have the best for you, and that's it. And I imagine that the success rates are better with sperm donation because you're having really good quality sperm as well. Exactly, and especially in recent years, the sperm quality for the men's and overall on the the global level is going down, unfortunately. Therefore, we don't use the sperm donors locally. We directly go to the good sperm banks and get it from there, because we know that they only go after with the top quality of sperms. And that has a huge impact, as you know, on the success rate. Therefore, for the sperm donation, success rate is last 3 years, when we take the average, is around 75%. It's a huge rate. And therefore, we don't really want to, for us, it will be, commercially, it has more benefit to go with the local probably donors, but we don't want to do that because we really want to, go take and risk and reduce our success rate on that program. That's why we really prefer to go with the sperm banks. And I imagine that the process is anonymous, so we don't know the donor who is donating the sample. Yes, and especially from the banks, that's the first contract that we sign. We don't know also, like, we get the sperm from them based on the profile. We don't know name, we don't know surname, nothing related with the identity. We only know the physical characteristic of the donor, and that's it. We get the sperm here into our hospital, store it here, and we only have numbers on them. So number 5, profile is blonde, blue, the blue eyes, weight is 85 kg and height is 1.75. That's the characteristic that we know. And so that's why we don't know. The family cannot know, the donor cannot find. It's completely, as you said, is anonymous. And Nevzat, so the legal rights are all falling on the couple, on the parents who have bought that sample. There's no legal rights of donors, and I think that's important to clarify as well. Yes, exactly. That's for the all donation program that we are offering here at our hospital. Donor has no right on the baby. First of all, the donor, that they don't know if ever we use their sperm or eggs. They never know, because we don't obligated to inform that we use your sperm. We get the sperm from the bank, we buy it, we store it in our hospital. Maybe I will use it in 3 years, maybe I will use it next week. They will never know, they will never notify it, and of course they will have no rights on the child legally. Thank you, Nevzat. You're most welcome.